Welcome everyone to this webinar on feedback informed treatment. We did promise that we were going to record this webinar for everyone. You've got me for this journey over the next 40 to 50 minutes around FIT and what it can provide to your private practice. And the first place I want to start is, I guess, a bit of an intro about myself. Many of you may know Ben as the co-founder of NovoPsych. I've come on board as an evaluation officer. And largely, my role, besides the training, is to help people to understand whether they're effective in their therapy, and perhaps even more importantly, what percentage of their clients get better, stay the same, or get worse. The reason we would answer these questions are to isolate those clients that we can focus on to improve their outcomes. And at the end of the day, that's really what I see therapy is all about. You will gain an understanding that I am a nerd, particularly in the realm of feedback-informed treatment. And I hope it does come across how passionate I am in this area. I invite anyone watching this recording to email me. You can see my email right there. If you have any specific questions that wasn't covered here, I'd love to know. Today, we are going to talk about a very brief summary of the research behind feedback-informed treatment so that you know that you're getting an evidence-based approach that you can use in your treatment. We're going to talk about using FIT with symptom-based or model-based measures. We're going to really put some time into the alliance measure and improving feedback in feedback-informed treatment. This is an area where I really hope people can take something away that's practical, and you are going to be able to get a resource that outlines how you might start putting this in practice today or tomorrow and for the rest of your career. We're also going to talk about lack of progress in treatment, whether a client is staying the same or getting worse in therapy. And we're going to give some examples of weaker versus stronger responses when that happens, so that you have kind of a guiding light on what it might look like to get a stronger response from yourself in therapy. Then we're going to talk about client satisfaction surveys, a lovely adjunct to get an understanding of what your clients think about your entire private practice process. For today, we will not be having a question and answer. So feedback-informed treatment. I love this graphic because it really hits at the heart of feedback-informed treatment. FIT is routinely using measures to gain feedback about when things are off track or on track so that strategies can be used to improve therapy. The cards that we have here are sympathy cards for scientists, condolences on your failed experiment, sorry to hear about your rejected paper, with deepest sympathy on your disapproved theory. The funny thing here is that these are the types of comments or feedback that we want in feedback-informed treatment. Some people have the notion that in feedback-informed treatment, we want positive feedback. It's really not so much the focus. Positive feedback can help our egos and help us bond with the client. We can celebrate and cheerlead what's working for them and in therapy. But it really is the information that tells us when a client is off track, when they are not getting better, or if the alliance is not really fitting for them, that enables us to improve therapy by adapting based off the feedback that they provide. This is really the gold here, and it requires a growth mindset to think about anytime someone's telling you that something's not working, that this is what you want. How do we know that things have gotten better for the client in terms of FIT? Not only do we need to adapt the therapy, but we also need to revisit and review the outcomes. So for example, in therapy, we would check the progress measure to see if they're actually now getting better based on the adaptations, or we might look at the alliance measure and ensure that the alliance is improving based on your adaptations. So let's talk a bit about fit and what my thoughts were about therapy before I found fit. For some of you, you'll be on your fit journey. For some of you, you won't really know what it is. And I think it's important to give you a bit of experience. Before I started feedback-informed treatment, I very much thought that what I needed to do in my first few years in particular was to add to my therapy toolbox, learn more skills, more strategies, become more robust. And, you know, the way to do that was to attend trainings to become more effective. And I did that rather compulsively now, I would say, on reflection. My first 2 years, I did a CBT intensive course. I learned acceptance and commitment therapy over a 3 or 4 day workshop. I did DBT, clinician-based work and group work learnings. I did motivational interviewing. I wanted to find every acronym under the sun and I wanted to learn it. And I didn't want to learn it for the sake of it. I wasn't throwing money away for no reason or time. I wanted to get better. And I wanted that for me, but I also wanted that for my clients. I wanted them to get better and more of them to get better. And I really thought that doing this kind of work, I could have more sessions with people, kind of keep them engaged in treatment longer, and that the longer you go, the more insights and improvements a client would get. And that I could then use outcome measures to kind of get accuracy, to kind of make sure that things were all good there. And this is how I saw therapy. It might be an approximation of how you also saw therapy, perhaps in your early career, perhaps now. This all changed when I found feedback-informed treatment. And here's a summary of the research indicating why. Number one, luckily for this training, therapy is very effective. It helps 8 out of 10 individuals that attend therapy. They're better off than those that don't. So this is really good. But contrasting to my prior beliefs, we do know that all therapy models are equally effective. If you laid out the hundreds of models and acronyms that we have at the moment, and you look at all the research that is available on those and averaged how effective each of them are, all of them are just as effective as each other. This has been demonstrated by Bruce Wampold and others and is known as the Dodo verdict. All have won and all shall receive prizes. And from there, it gets even a little bit more shocking. This was very different to how I had previously thought of therapy. Therapy effectiveness plateaus after 2 years. Put another way, 2 years after your postgraduate training, that's the height of your effectiveness. If you put in some energy, you will kind of keep at that level of effectiveness. If you become really automatic in what you do day in, day out, you'll become less effective over time, not more effective. This is a huge contrast to what I believed prior. And FIT is one of 2 strategies that we know that can help to improve effectiveness over time, largely through finding out what's not working and changing that. The other factors that were a very big surprise to me was that it's actually the alliance that is the biggest predictor of outcome, not necessarily all the tips and tricks in your toolbox. And above that, improvement within 4 sessions is associated with end of treatment improvement. So my notion that, the longer the amount of sessions, the better for insights and improvement was actually incorrect. There's a diminishing amount of returns that come over time. You really do want to notice and try and get an improvement within those first 4 sessions in particular. And if it's not working, adapt your treatment, get feedback from the client. What could we do differently? Explore what it is you could change. And lastly, measurement and applying outcome measures just for accuracy doesn't improve anything. They need to be integrated to get improvements in therapy. That is, when you get the results, you want to actually talk about it with your client. You want to understand why things are getting better, or importantly, why they're getting worse, why they're staying the same, and what you can do differently. So the fit journey does take time. The key steps I want you to hold in your mind as you go through this journey is choose the measures that fit for you. Learn how to create a culture of feedback so your therapy fits your clients. And learn how to adapt your therapy in response to your client's feedback. So choosing a measure that fits you. In feedback-informed treatment, we need two things: an alliance measure that measures the therapeutic relationship, as well as a progress measure that looks at the progress a client is making in therapy. Which measure you choose depends on your values and what you think improves in therapy. So I'm going to say that again. You do not choose an outcome measure just based on what other people are doing or the one that's available. What you want to do is to think about the one core thing that you change in therapy, that you believe you have an impact on, and then measure that. Because your sense of belief in what you change in therapy, once you measure that, is very fertile ground for great discussions on how the therapy can be adapted. There's a few key domains that we generally place these in. One being, many people feel that well-being is the key factor that they change. Other people, it's functioning. Other people, it's a client's values. Other people, it's client distress. And for other people, it's client symptoms or the particular type of issue that the client faces on the start of treatment. And of course, we've got the alliance, which should be in feedback-informed treatment measured for all clients. But I do want you to take a moment, just this second, to think about which one of those you would choose that you change. Because now we're going to actually help you choose the measure that works for you. Based on what you have chosen as the core thing that you change in therapy, we have a whole list on each one of those domains that explains or describes the scale. This is not every scale in the world. These are what we've got here involved with NovoPsych that is available to you. So well-being domain, you could choose the satisfaction with life or the flourishing scale. If you really thought that functioning was the thing that you improved during therapy, you could choose the emotional regulation scale, the COPE scale, close relations scale. If you felt that you really changed values or a client's alignment to values as part of therapy, you could choose the value scale or the self-esteem scale. If you felt that you changed distress, you'd look at the core 10 that every GP conducts, the K10 that every GP conducts, or the core 10. My thinking there was, because that's the one that I use, or the core OM, which is a longer version of the core 10, or the scale of positive and negative experience. Or if it's symptoms that you feel you change, there is a whole host of measures that measure anything from anxiety, body dysmorphia, OCD, pain severity, substance use, developmental issues, the list goes on. My hope is that from looking at this and knowing the domain that you feel you change, you can choose one that you are going to administer as part of your progress measure. The progress measure is provided to your client at the start of each session. Something like, one of the things about therapy is that it's important we know if we're on the right track. For that reason, I administer this X scale so that I can monitor whether you're improving, staying the same, or getting worse across treatment. I'm going to get you to fill this out at the start of every session. And the first thing that we're going to talk about at every session is how you feel when you look at the changes over time on these graphs and why you think you're either getting better, staying the same, getting worse. Something in that realm, but of course, using your own special source as a therapist so you can connect with your clients. That was really just off the cuff. And the alliance measure. So some people would have used this, some people never would have. We administer the alliance measure at the end of every session as a way to ask how the session went and how the relationship went. The Agnew relationship measure, or ARM5 as it's known, has 5 questions, and they look at the bond and confidence around a clinician, and all together kind of put together what you see here in the graph in red, which is the alliance with the therapist. In my experience, it takes anywhere from 20 to 30 seconds to complete. But you do need around 5 minutes at the end of treatment to talk about it, okay? Here you can see that in the first and second session, it was positively rated, around the same, and then the third session, it dipped. Now, in every one of these sessions, first, second, and third, I asked specific questions of the client after they'd rated it, and I asked, what could we do more or less of in session to make the alliance improve by just 1 point? Notice I'm really inviting feedback that is specific from this client. What do we need to do more or less of? Now, in that third session, when it dipped, I made a bigger point of it. And I said, you know, when I notice even a dip of 1 point, I think to myself, we probably need to adapt something so you get the most out of your therapy. It's a bit like when you get a suit tailored. You know, if you've got just a tight part near the ribs, it's not that big of a deal at the start, but over time it can wear and it can become irritating and it can become something that's no longer a good fit for you. I don't want that to happen to us in therapy. So I want to get a gauge from you. What do you think we could do more or less of this session to mean that that rating of the alliance improves? In this example, the client told me that they actually wanted me to be more direct. And I asked them, what do you mean? What does more direct mean to you? So notice I'm getting more specific so that I can actually replicate what they want. And he said, sometimes you propose ideas or options in therapy that we could try, and you leave it up to me to choose. But I don't want that. I want you to choose the option and for us to then do that option, and then I'll learn from experience whether it fits for me or not, and I'll let you know. And I was like, anxiety going up, because I'm very collaborative. You know, I want to co-create the therapy all along the way. But at the end of the day, is that helpful? Not for this particular client, it wasn't. So next session, I said to him, this is what you told me you wanted, and we're going to try it this session. We're going to see if this improves things in terms of your experience of the session. And I was more direct, and I told him we're trying this, and he said he really liked that, it worked for him. And at the end, you can see a much higher rating of the alliance. And this client went on to improve significantly. This is what we're talking about when we're talking about a culture of feedback and using the alliance measure or the progress measure to integrate into therapy. There needs to be a meaningful conversation afterwards. We don't want to be those waiters that walk over to a table and say, is everything all right here with your meal? I'm pretty sure all of us say, yes, it's fine, even if it's pretty crap. So one of the things that people need to realize is when you use an alliance measure, it is trickier than it seems, because 90% of people are going to say everything's all fine, unless you put in specific strategies to elicit feedback that you can adapt treatment with. People who are good at using an alliance measure get over 50% of their clients giving feedback. So if you've got 7 clients in a day, 3 to 4 are giving you specific feedback on what they want from you so that their treatment is different, better. Notice at this point, we're not talking about models anymore because your client won't know what models you use and you don't use, okay? They're usually very pragmatic things that a client wants. Now, this is from an amazing study in 2016 looking at the rates of mistruths, I guess, that clients provide in therapy. What's the most common? What's the least common? And it's just a nice way to think about why clients aren't going to give you all the honest feedback that they may think. So most common is clients pretending that they like the therapist's suggestions. Oh, if we actually just facilitated a lovely culture of feedback, they can tell you, I don't like mindfulness. I can't tell you how many times I've heard that when I start doing a really good culture of feedback. Or, you know, when you use this voice, when you're using progressive muscle relaxation, it actually gets me more stress. Very practical, very easy to adapt treatment. Similar to that, clients in this study were giving mistruths about why sessions were missed or attended late, and they were pretending that therapy is more effective than it is. This one in particular is important to note because if you use a progress measure, whatever you choose from that list before, the DAS-21, the CORE-10, the quality of life scales, this can't really happen because you both know whether someone's getting better or worse. Pretending to do homework or therapy actions was another one that a lot of clients didn't want to be forthright in. The real opinion of their therapist. Now, this is what you start getting to the nitty-gritty of in the alliance measure, okay? As long as you can invite a culture of feedback and it's safe to do so. Not disclosing wanting to end therapy. Now, this is a missed opportunity if I've ever heard one. The more that I've known about FIT, the more that I realize that if you get someone, say, on a distress measure improving, so their distress coming down, 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 and maybe they're mild or maybe in the non-clinical range, like recovered, right? If they don't disclose that they want to end therapy there and you just continue, do you know what on probability is going to happen? They're going to start getting worse again. And so you're going to start riding this roller coaster when in fact you've done all the good work. The client might be holding back that they want to end. That's a huge missed opportunity. The lesser common mistruths from clients was that the therapist makes the client uncomfortable, that the client can no longer afford therapy, or even in some cases that the romantic feelings towards a therapist a client was holding. So, how do we improve the chances of getting feedback from our clients? I'm sure that there's many people watching this at the moment that do ask for feedback. We're kind of trained to do so in a way, to do check-ins, aren't we? How is this working for you? How are you finding treatment so far? These kind of general statements that are, I guess, checking the temperature of a client, how they're feeling. A lot of the research suggests that these kind of general statements, whilst, you know, really good practice, very rarely get a response where you can adapt treatment. The one that I used to use was, what can I do differently next time we meet so that you'll find the next session more helpful? I asked that for years. Number one, just as a tip, if we're going to get really practical here, don't do what I did. Don't use I. The rates of people wanting to give you feedback, if you make it personal and about you, saying things like, what do you want me to do? They plummet. You just don't get feedback because people think that they're going to criticize you, that you're going to have hurt feelings. The other thing here is, in this example, what can we do differently? There is a million, if not a billion, answers to that. It is not really specific enough to get down to a particular invite for feedback. So I can hear you saying what works. And we have some key principles here. A good feedback question is specific, detailed, task-orientated, and with a here and now focus, okay? So these are the principles we want to hold when we administer the alliance measure, the ARM5, to a client on the iPad. The client fills out the 5 questions about their bond with you, their confidence with you, and you get a score back. Notice you actually ask this no matter the score. If you're getting perfect marks, especially early in therapy, that can sometimes indicate that they don't feel safe to give you feedback. It doesn't actually mean perfect scores. What we are looking for is early in therapy, the first or second sessions, that they give you lower scores that improve over time, okay? So every session, asking a client or inviting a client for feedback, okay? And so we can be more practical, less abstract, we've actually cultivated from some of the research and adapted for your use 3 questions, okay, that you can use, 3 example questions. I want you, once these 3 questions are up, to either jot them down or take a screenshot, because you're going to start using these as of today or tomorrow, okay? And you're going to find out the one that works for you. Example 1, what would need to happen more often for the score on the session alliance measure to improve just by 1 point? Notice, not personal, not I, not me, just what would need to happen more often, okay? So something that's already happened in the session, what needs to happen more for it to just go up 1 point? Another example, thinking back on this session, what specific moments come to mind when the session alliance score might have been a bit lower or a bit higher? What has caused that? So really getting into the nitty-gritty of the particular session and an example, and asking why it worked for them or didn't work for them. And lastly, is there anything that happened or didn't happen during the session today that would make the score on bond or goals increase by 1 point? Again, inviting the conversation about what's missing or what is already there that could change. So let me get more practical for you, because the feedback we got is that people want to be able to do this in practice. So that requires me to be very explicit about what I suggest people do next. This is what I suggest you do next. We have provided a resource, or a resource will be available on the website where we've got this webinar. And what it really highlights is, what question do you choose out of these 3 questions, writing that down. Then it's going to have a bit of a diary of 2 weeks, okay? And your job is to fill in each day how many clients you gave this feedback question to after you did the ARM5 versus how many clients attended. And then writing down whether you used it more frequently over time. You'll understand as you look at the resource, but essentially what we're saying is, on the first day using this, you might have used it only once, okay? On the 3rd day, it might have gone up to using it with 4 clients. After 1 week, you might be using it with 8 clients, and so on. And if it's not improving or increasing over time, what's getting in the way? What are you finding is a struggle to administer the alliance measure and then provide this feedback question, knowing that this is what's really going to help improve your therapy effectiveness, okay? After that, on the page, it'll have areas for you to write down your reflections and insights. And importantly, after 2 weeks, how you want to adapt this question of the question that you choose from these 3 examples. So adapting it to your style, because we're not about scripts and everything here. It's just a way to learn. Adapting it to your style means it has your special sauce. The client's going to go, oh, this is how my therapist talks. And it's going to mean that it really consolidates in your mind as well. I really strongly invite you to do this. This 2-week trial could literally change the way that you do therapy into the future, and certainly has the ability to improve your effectiveness over and above any workshop you do, any model specific certification that you do. So 2 weeks of work, I think is well worth it for what the benefits you could receive as well as your clients. And at the end of the day, not only does it help clients, but it really helps your referral base and it reduces dropout. Because the one thing that I struggle with a lot is the experience of having a client, having some preparation, and I see an empty chair at that time. It's really hard. And it contributes to sometimes my feeling of fatigue. Doing this kind of stuff reduces the likelihood of that dropout occurring for you. So let's talk about a client who's at risk of a poorer outcome, that there is a lack of progress. We find this out via the progress measure, whether you're using the DAS-21, the Core 10, quality of life, or anything else. First off, just like the Alliance measure, make sure there's a culture of feedback where the progress measure results are discussed in therapy. If you get a client to fill out a DAS-21 in the waiting room or just via email and it's not brought up in session, guess what? They're not going to have much buy-in to give you feedback if they're not getting better, okay? They're just not going to get the understanding that you measure this for a reason and that you are flexible enough to adapt based on their feedback. So there is, again, as part of your resource pack, some scripts to help you start having these conversations. The scripts are a foundation point. They're a springboard for you to create these in your own image, okay? Second, identify a lack of progress when you see it. First 4 sessions, getting worse or staying the same, is indicative of a poor response overall. So these are my actual clients. One here is on the DAS-21, and you can see in that red line over 4 sessions, this client is not getting better. They are in the extremely severe range. They are not changing. And I need to do something different. I have to have a frank conversation with my client and figure out what they need from me or outside the therapy room to make sure that they reduce in their distress. We've also got a graph indicating another one of my clients' results on the Core 10. Now, this is a measure of distress, and we can see that it's slowly going up over time. This client of mine is getting worse in my care. They're deteriorating in my care. And again, within 4 sessions, I've noticed that. And we talk at every point here about every session, how their distress is going. And we stopped and we had a frank conversation for 15 minutes trying to explore what might need to change. Importantly, these indicate a lack of progress. They don't tell you what you need to do next. So we have resourced a whole bunch of information so that you can understand what to look for and the potentials of what to do next with clients. So I'm going to give you here some ideas on, I guess, creating a hypothesis in your mind before you see a client and they're not getting better. What could it be? You know, this is information gathered from Jacqueline Pearsons and Michael Lambert, who are both experts on this area and both practicing clinically as well as doing research. There is a reminder, start with the Alliance first. It has the greatest predicting level. So, you know, if a client isn't getting better on the DAS-21 or the Core 10 or whatever it is, check their ARM-5, their Alliance measure. Is that also going down? If so, ask what they want different in the relationship, how they want you to be before moving to this. Hypothesis 1, when you see a client with lack of progress in 4 sessions, poor motivation. Does this client feel the fire to change and do what is necessary in therapy to feel better? Hypothesis 2, are the sessions frequent enough? This is a particular problem in the days of COVID. Referrals are high, caseloads are high, and sometimes if we're not checking in, we're finding that a client's actually not getting seen enough. And if that's the case, this is a nice hypothesis to look at. You know, do you need to make room for more frequent sessions for a client who is not progressing? Hypothesis 3, is adjunct treatment required? Do they need assistance with a psychiatrist or a physio, another, or anything else? But a benefit of noticing this early is you can send off this referral, or you can get in touch with the GP or the professional, and it might take 4 weeks before this client can be seen. The earlier you identify this, and if the client agrees, then this is a really good thing for the course of therapy. Hypothesis 4, the client might have low social support. In these moments, we need to think about things like yoga, parent groups, men's walking, these kind of things. And lastly, one of the hypotheses we think about is unclear therapy goals. And in fact, the majority of clients with poor outcomes meet this criteria. When I'm supervising a psychologist and they tell me, you know, I've got this client, I'm a bit stuck, that's the feeling, and I'm noticing we're at the 4th session and they're not getting better. In fact, they're getting worse. The first thing I'll ask is, what's the client's goal? And sometimes I get an answer that's kind of like, the client wants to manage their emotional dysregulation and, you know, feel better in the interpersonal sensitivity. Immediately, I am under the impression that this is not the client's goal. The reason is I've never met a client that talks like that. That is the psychologist's interpretation of the goal based on models and theories and all these kind of things. Having a goal and understanding the goal is a really good way to predict outcome for a client, but not if it's your interpretation. Only if it's in the client's words. So the client's actual goal might be, I want to be less angry so I can get on better with my wife. That is the goal, okay? If you don't know it from your client's words, you probably don't know the clarity of goal required. Doesn't mean that you can't get it more specific. You might have a client that says, I want to feel better. We all know that that's not a great goal. And you can prompt questions to understand what that would mean for your client. But ultimately, it's the goal in your client's own words that we're looking for. These are 5 hypotheses that you may think explain the lack of progress in your client. The next step is to actually ask the client. Go up to the client in the next session, go, I'm noticing that things aren't getting better. This is the reason why I think, what do you think? And either have your hypothesis confirmed or refuted, and adapt your treatment based off the feedback from your client. So let's talk about examples, what this actually looks like. And I've recorded myself providing a weaker response and a stronger response to a client who's got a lack of progress. This first one is a weaker response. It's about 40 seconds long, and that's indicative of a few things. I'm going to show you that and point out where I might have gone wrong. So we're 4 sessions in, and we've done the core 10 scale of distress, like you do every session. And we're noticing here that the distress is going up. Is that consistent with how you feel things are going? What's happened here is that I have attended to the lack of progress. This client hasn't gone better over 4 sessions. But the question that I've put forward to the client is whether it's accurate. That doesn't really lend me anywhere to move on adapting the therapy. I used this specific question for a year, 2 years before I learned more about feedback-informed treatment. And what I noticed when I changed the way that I asked the question about people and clients who have a lack of progress, they often were able to provide me with what they needed. Probably 3 or 4 times the amount of accurate feedback or actionable feedback was provided. This is an example of one of those times, although the client itself is an actor, so worth knowing for ethical reasons.
So, it's our fourth session today, and you've been attending every session, been engaged with the process, and looking here, you've filled out the core 10 as you do every session, measuring your distress in treatment. And we can see that, distress is going up, meaning that you're actually getting worse in treatment. Really importantly, I don't want us to sit on our hands. I want us to check in with some things that, through my experience, I've found can mean that we've gone off path, like we may have at the moment. So, when you first came, you said to me, your goal is to reduce your drinking or stop your drinking. And I want to check in with you, your heart of hearts, is that still your goal? Is that what you want? Or is your goal different, Trent?
No, well, I don't particularly want to reduce my drinking. I enjoy drinking. What I would like to do, though, is to have a better relationship with my husband. So I guess really my goal has changed a little bit because I want to maintain the social aspect of drinking.
Okay. You know what? I'm really happy to ask the question because you've given me what we call an approach goal, moving towards something that is good in your life, like your husband, your relationship. And you have told me before that some things have gotten in the way of that joy, like drinking. But in fact, it's not about the alcohol at all for you, is it? It's about getting that marriage back on track. Maybe that's what we should be focusing more on. And if we're on the right track, I anticipate that we'll start seeing that distress coming down. If we don't, I'll check in again with you on anything else we can change.
You can see there's a difference in the duration of the conversation and that it gets to a level of specificity that we can actually change treatment. A barrier I can find that some people have to having these kind of discussions is talking to people. They can say to me things like, I get how it would be helpful, but it's taking time out of the session. We've got so much to get through. I often say, that is true. We do need to balance the amount of time and managing the time. We want to help a client as much as possible with the time that we have. But that over time, the more you have these conversations, they become pretty brief. This is 2.5 minutes. But moreover, even if this is a conversation for 10 or 15 minutes, this is your fourth session. And we've identified this client isn't getting better. Without this conversation, I literally would have stayed on the course of reducing or stopping her drinking, which was her goal. And this is from a real case, the example at least. I guarantee you she wouldn't have got better. She didn't want it. And so as much as I would have saved time by not having this conversation, I would have gone session after session after session in the wrong direction, which means it's only going to take a whole lot longer to get back to where she wants to be. Or I could be faced with an empty chair at some point, which is the worst case scenario. That's why having these conversations can help your therapy effectiveness so much, and you're just going to help more and more clients. We're going to talk a little bit with our time left about client satisfaction surveys. What are they and why use them? This is an example client satisfaction survey, and really what it gives you is an idea of how a client is satisfied with the practice as a whole. Things like how helpful is reception, how much can they get an appointment on time, things like how helpful are you as a clinician, how prepared are you for their sessions, and it gives you a nice kind of overall value about where that sits. The exciting thing is we're actually at the moment calculating norms on Australian private practices. Soon enough, this will be in NovoPsych and integrated so that when you send it off, you'll actually get an idea of how satisfied your clients are compared to other average psychology practices in Australia. And we really think that it's only going to be so helpful to help therapists and their business owners provide the best possible practice. For my money, at the very bottom, these qualitative areas where a client gets to type in their areas of strength of their therapist and their suggestions for improvements are also where the gold is, because that describes what you can do to help your practice. With an actual case study, here are the results of mine that I did for 2020, 2021. It was just shy of a year of practice. And you can see here that with the graph, my areas of strength appear to be my preparation for sessions and how helpful reception was. But my areas of weakness were in fact the consistency of the information that I provided to my clients, as well as their perceptions of how much better they were getting in their quality of life. Both of these are fascinating to me because I use a progress measure that measures distress. And so we don't really talk much about quality of life or well-being specifically. That was a really interesting reflection for me. The other thing is therapist consistent information. I've got a feeling that is a reflection of my understanding of Medicare when we went to COVID, which again gives me some pretty nice little feedback on what I need to brush up on. The qualitative themes, there was some strengths there for me, being non-judgmental, calm, engaging. And the limitations or the weaknesses was that more time in sessions were needed. And in fact, there was some specific feedback that clients, and a few clients, would suggest that they would pay for an extended therapy session, an hour and 15 or an hour and a half. And I thought that was really, really interesting to think about how we might provide a really adaptable, flexible practice. This is a summary on how to put into practice feedback-informed treatment. Tip 1, the steps to integrate progress measures into your therapy. Gain feedback from your clients about whether they are on track or off track as measured by the progress measure graph. For example, the DAS21, the quality of life scale, whatever you chose to use. Hypothesize with your client as to why they might be off track and get actionable feedback from your client on how to adapt therapy to better fit their needs. This is like the example that I provided before around the woman that wanted to stop drinking. And in fact, when we revisited it, my hypothesis was that the goal was unclear. She wanted a better relationship. Number 3, put in place the treatment adaptations. Don't just hear what is had to say and keep doing what you do. Change your treatment. And number 4, review progress measures and see if they've improved as a result of the adaptations. In the example that I provided of the client with the drinking, I said, I predict that your distress is going to come down over time because we've had this chat and we want to try and improve your relationship. If it hasn't, I'll revisit this with you again. Okay, so we're really checking in to make sure that it works. Tip 2, monitor the alliance as it improves client outcome. Create your own alliance feedback question based on the example I provided and the resource that we provided you today. Use it with every client at the end of the session, be open to their feedback and use it to tailor the delivery of your treatment. Tip 3, enhance practice quality by using these satisfaction surveys. Now, bit of a tip, it's not actually on the website, the client satisfaction surveys, but once you log into NovoPsych, you will be able to see that assessment. Email the client satisfaction surveys to clients annually or get them to fill it out in the waiting room. Use the information to reflect as a therapist or as part of a team on what you can improve, and then implement client feedback to enhance the quality of your practice. We do have some upcoming training at the moment, which is the outcome analysis training, where we're actually running for 9 weeks, kind of dipping in and out with some hour sessions for people, basically coaching in small groups of 10, how you can collect the best data for your values. And then we're going to end up developing a report for you, showing how effective you are as a therapist, what percentage of your clients are improving, what percentage are getting worse or staying the same. And this really enables you to enhance your practice. And I just really appreciate you taking the time, an hour out of your day, to learn about feedback-informed treatment. It is something that I'm so passionate about, and I do believe that Australia is going to be doing more and more. So I love the fact that you are trailblazers in this area of practice. Here is my email. Please feel free to email me at any time. Any questions you have implementing this, any questions that you have about feedback-informed treatment at all, I'd be more than happy to help. Thank you.